Hello, and welcome back to Mumaflix Pregnancy Series. In this video, you will learn how you can cope with anxiety during pregnancy. We also want to emphasize the importance of regular exercise to keep your body and mind healthy. Some degree of worry is natural during pregnancy. After all, the process may be entirely new for you. You may worry about whether your baby is healthy, have fears about being a good parent, or stress about how your relationship with your partner will change. You may even have faced situations in the past, like a miscarriage. However, if these feelings are persistent and strong enough to interfere with your daily life, this may be an anxiety disorder, a type of mood disorder. Anxiety is very common during pregnancy and can be dangerous if not properly addressed and treated with the help of your support team. Since there are different types of anxiety disorders, the symptoms vary. Speak with your doctor about any symptoms you experience so he or she can accurately diagnose and treat you. Some common symptoms of perinatal anxiety disorder include anxiety or fear that interrupts your thoughts and interferes with daily tasks, panic attacks, outbursts of extreme fear and panic that are overwhelming and feel difficult to bring under control, anxiety and worries that keep coming into your mind and are difficult to stop or control, constantly feeling irritable, restless, or on edge, having tense muscles, a tight chest, heart palpitations, or experience excessive sweating, finding it difficult to relax and/or taking a long time to fall asleep at night, anxiety or fear that stops you going out with your baby, anxiety or fear that leads you to check on your baby constantly. When these symptoms come on quickly and intensely, you may be experiencing a panic attack. People with anxiety experience the same symptoms and panic attacks regardless of whether they are pregnant or not. However, when you are pregnant, your concerns about the health of your child can increase the effects of your anxiety attack dramatically. That level of anxiety and the physical effects of anxiety can have potential risks for your health and the health of your baby. Depending on personal preference, you and your doctor can choose between many different options of treatment for perinatal anxiety. The first one being counseling or therapy, where you will discuss your thoughts and feelings with the counselor or therapist, who will help you understand your feelings and cope with your anxieties. You may learn to practice specific techniques such as cognitive behavioral therapy and interpersonal psychotherapy. The second option is choosing support groups. These are groups of people going through similar circumstances who meet in person or talk online to share their feelings and experiences about specific topics. And the last option is medication. If your anxiety is severe, your doctor may prescribe one or a combination of medications. Your doctor should discuss the benefits and risks of taking medication while pregnant, so you can make an informed decision about your treatment. Your doctor will prescribe the safest medication at the most appropriate dosage. Making changes at home may also help you manage your anxiety symptoms. Allow yourself to relax, slow down, cut down on chores and tasks, and put your health and well-being first. Taking care of yourself is vital to taking care of the baby. Some changes that may help manage anxiety symptoms include exercise. Exercise is a natural way to increase serotonin levels and decrease cortisol levels. Speak with your doctor to find out the best workouts that would be safe and appropriate for you. Exercise classes are designed for pregnant women and may be available to you. Eating a healthy diet. Many foods have been shown to affect mood, the ability to handle stress and focus. Caffeine, sugar, processed carbohydrates, artificial additives, and a lack of protein can negatively affect your mental and physical health. Ask to speak with a registered dietitian to determine an individualized healthy eating plan that would most benefit you. Getting enough sleep. A lack of sleep can greatly affect the body's and mind's ability to handle stress and cope with the day-to-day challenges. Although anxiety can affect your ability to sleep, Try to establish a sleep schedule routine so you go to sleep and get up at the same time each day. Meditation and breathing. Activities such as meditation and deep breathing practices can help your body release endorphins without working up a sweat. It is recommended to do deep abdominal breathing for 20 to 30 minutes daily to help with anxiety. It will help provide more oxygen to your brain and stimulate your nervous system. Meditation can help you refocus, calm down, and clear your mind of intrusive anxieties to better cope with any issues. Some people prefer to work one-on-one with a professional, while others get more out of a group environment. It's really up to you. Treatment or therapy groups are usually run by a trained mental health professional for a set time, for example, 10 weeks. If you find the idea of seeing someone a bit daunting, or there isn't anyone locally that you can access, online and phone counselling can be a great help. Online services, also known as e-therapies or computer-aided psychological therapy, can be just as effective as face-to-face services for people with mild to moderate anxiety or depression. Most e-therapies follow the same principles as cognitive behavioural therapy by helping you to identify and change patterns of thinking and behaviour, and the structured nature of these treatments mean they're well suited to being delivered online. It's important that you speak to a midwife or health professional about your mental health condition, as there is a risk it could come back and worsen during pregnancy. If you are or were taking medication for a mental health issue before, you should talk to a health professional if you want to stop taking it. Stopping may be dangerous for you and the baby, and a health professional will help you find an alternative if you prefer not to take it. Health professionals are on your side and want you to be well in pregnancy. They will do everything they can to make this happen. With the right treatment and care, most women with mental health condition have a healthy pregnancy and baby. Exercise is a crucial part of healthy pregnancy. Being in shape improves overall health and helps ease symptoms of anxiety during pregnancy. When choosing exercise during pregnancy, find an activity that increases heart rate to a moderate level without exhausting the body or increasing core body temperature too high. Take precautions when doing certain water activities. Elevated body temperature, whether from exercise or fever, is associated with an increased risk of birth defect. Always remember to avoid exercise with a high risk of falling. Avoid outside exercise on hot days. Avoid contact exercise, including contact sports. And avoid exercise at high altitudes. Some good sport examples include running, jogging, swimming, walking, tennis, golf, cycling, and bowling. These sports tend to be relatively low impact or low risk of falling. On the other hand, there are some activities and sports which are better to be avoided during pregnancy. Football, skiing, skateboarding, rock climbing, roller skating, scuba diving, weightlifting, and mountaineering. These sports tend to be high impact or high risk of falling. You may need to slow down as your pregnancy progresses or if your maternity team advises you to. As a general rule, you should be able to hold a conversation as you exercise when pregnant. If you become breathless as you talk, then you're probably exercising too strenuously. If you weren't active before you got pregnant, don't suddenly take up strenuous exercise. If you start an aerobic exercise program, such as running, swimming, cycling, walking, or aerobics classes, tell the instructor that you're pregnant and begin with no more than 15 minutes of continuous exercise 3 times a week. Increase this gradually to at least 4 30-minute sessions a week. Remember that exercise doesn't have to be strenuous to be beneficial. Here are some things to keep in mind when exercising. Number 1, always warm up before exercising and cool down afterwards. Number 2, try to keep active on a daily basis. Half an hour of walking each day can be enough, but if you can't manage that, any amount is better than nothing. Number 3, avoid any strenuous exercise in hot weather. Number 4, drink plenty of water and other fluids. Number 5, if you go to exercise classes, make sure your teacher is properly qualified and knows that you're pregnant, as well as how many weeks pregnant you are. A highly recommended type of exercise during pregnancy is yoga. Plenty of evidence shows that prenatal yoga has important benefits for the physical and emotional health of women and their future children. Any woman who is feeling stressed, anxious, or depressed during her pregnancy will benefit from practicing prenatal yoga. The practice focuses on poses for pregnant women in order to increase strength and flexibility while also relaxing the mind. Please check out our bonus videos on some simple but very beneficial yoga practices you can do at home. Anxiety during pregnancy is common. It's also highly individual, so what may work to help your friend may not alleviate your own worries. Keep the lines of communication open with the people you love. Try some stress management techniques and keep your doctor in the loop. Taking care of your own mental health is really important, as it can really impact your overall quality of life and those around you.